I'm Babette Rump. I'm a medical doctor slash philosopher, and I work here as a professor at University College Roosevelt. And today, indeed, I'm going to talk to you about something that most of us actually tend to ignore for as long as possible. I want to talk to you about death. Because since ever I was young, I have always been fascinated by eternal life. As a child, I used to love listening to stories about fairy tales, about princesses that escaped time. Think of Snow White, who slept for over a decade, or Sleeping Beauty, who slept for over 100 years. But I was never that much interested in the princess that woke them up. No, I was more fascinated by this idea of waking up in a complete new era. What would it be like if you alone get to live so much longer than all the other people? What would it mean for society if some of us live forever? So when I grew older, I stopped listening, of course, to fairy tales, but I started to watch television. I used to love watching movies and shows about eternal life, and I especially remember this show about a man who was immortal. The show was called Highlander. I'm not quite sure if people are my age and know it. Yeah, it's in essence, it's about an immortal guy who fights other immortal people, and I don't really remember that I was that much fascinated by his fighting skills. I was more fascinated by this idea that some of us, some among us, get to live forever. And it raised questions like, what would it be like if I lived forever? What would my love life would be like? What would I invest in if I knew that I lived longer than other people? What does the concept return of results mean if you get to live longer than others? What about social security? Or maybe on a deeper level, what about democracy if some of us, just a random few among us, get to vote forever? So then I started med school, and I learned that I'm not the only one who is so interested in eternal life. There is so much money spent. There is so much research done. And there's so much clever people into finding out why some cells escape mortality. Finding out the holy grail of eternal life. I learned all about telomerase and telomeres. I learned about stem cells and pluripotent stem cells and what have you. All those things. And I read it all. I loved it. Up to the point that I started to practice medicine and also started a family. And most of you don't have that age yet, so I'm not going to bother you with it, but at that time I was mostly fascinated by sleep. That was the only thing on top of mind. I forgot about all my other interests. Up till just a few years ago. About 5 to 8 years ago, there was this philosophical / medical journal that invited me to write about eternal life to celebrate yet another birthday of Kane Tanaka. Now, who's Kane Tanaka? Let me help you. Kane Tanaka is a Japanese woman who at that time was already living for over 110 years. 110 years alive and kicking. 110 years still counting. That's amazing. That's incredible. And it really sparked immediately my initial interest in eternal life, and I started to Google the World Wide Web, and I started to find out everything there is to know about her. And that's when it hits me. At that point I realized there is nothing special about Kane Tanaka. Now don't get me wrong. It's incredibly special if you're able to live that long. And as I learned from my search on Google, she was also a special woman. A nice, likable, special woman. But that's not what I mean. What I mean is that she didn't do anything special to get that old. The only thing she did, the one and only thing that she did and she kept on doing over and over again, is simply not die. She didn't die during birth. She didn't die of a childhood disease that is easily preventable. She didn't die of violence or an unsafe surrounding. When she grew older, she didn't die when she gave birth herself. She didn't die during war. Remember, she's Japanese. She didn't die during war. She could have died from typhoid fever, but she didn't, because she had access to good quality, basic healthcare. She also could have died of cancer, If I'm correct, or if Wikipedia is correct, she could have died twice of cancer. But she didn't, because she had access to basic but good quality surgery. And as she grew older and the world around her changed, she kept on doing this not dying. While others died of cardiovascular disease, bad diet, diabetes, all those kind of things, she didn't, because she had access to good quality food. And that is the thing that we need to talk about. That is the big elephant in the room. While some of us get to live the full potential of the life naturally given to us, others still die immaturely. They die because of diseases that are fully preventable. There is a huge gap between people that get to live the full life expectancy and people that die early of preventable diseases. Now let me give you the numbers. And to be honest, the numbers vary depending on which source you consult, but on average, people in high-income countries, they are already counting on an average life expectancy of over 85 years. Japan at the top. But people in lower-income countries, Central Africa, they cannot count on as much as 55 years. That is a gap of over 25 years between people's lives. Some people get to live 25 years longer than others. Now don't get me wrong, I'm a medical doctor enough to know that people die. What I'm talking about is preventable death. Easily, cheap preventable deaths that happen every day. And even in those high-income countries where people can count on long life years and long life expectancy rates, even there is a huge gap between the rich and the poor. The WHO regularly reports on it, and they show that it's over 10 years of the rich and the poor. Now, what does that mean? Well, I think this is incredibly unfair. And I don't only think it's incredibly unfair because of the blunt fact that some people get to enjoy life so much longer than others. But the impact goes way beyond there. Think of what I tried to explain, what I thought of when I was a child. What does it mean for democracy if those people that benefit the most of the system get to vote the longest in the system? What does it mean for a return of investment if you know that you get to live so much longer than others? And who are the people that get to decide what we should focus our research on? Today, we focus so much on eternal life. But don't we have a moral obligation to give everybody the opportunity to at least live the length of their naturally given life? What do you think would happen if we asked those people in those low-income countries with those lowest life expectancy rates what they would want to spend our collective money on? Well, I think they would choose sanitation, safety, hygiene, preventable infectious diseases. A government that protects them from an unsafe surrounding, protects them from smoking, from unhealthy diets. Those simple kind of things. And let me tell you, as a public health specialist, I know these are not even expensive things. They can easily be combined with high-tech research on eternal life. So next time, when you hear about a new invention that brings eternal life yet another step closer, people, please mind this gap. The death gap, that is. And in case you wonder what happened to Kane Tanaka, well, she died at the respectable age of 119. If I'm correct, a natural death.